Young people are being killed by an epidemic that most of us are not aware of. Now, you might be thinking HIV, malaria, road traffic accidents, or even cancer. Well, it's none of these. See, the leading cause of death among 15 to 29-year-olds globally is suicide. Yes, suicide. According to the World Health Organization, every 40 seconds, someone somewhere in the world is taking his or her life. And most of those deaths are occurring in low and middle-income countries like my country. And the usual trigger is depression. But for a lot of these young people who are taking their lives, there are wider events that are associated with the depression: displacement, poverty, conflict, loss, isolation. The list is kind of endless. But the good thing is we can treat depression and we can avert the suicides. But we obviously don't have enough professionals in the world to do that. In my country, as you heard, there are only 12 psychiatrists, and I'm one of those 12. And in a lot of other countries in Africa, it's pretty much the same. You know, you have a ratio of 1 psychiatrist to about 1.5 million people. So it does sound kind of dismal, but let me put it into context to share with you part of my work. So one evening I get a call from the ER doctor, or the emergency rooms doctor, in a city called Mutare, which is some 200 miles away from where I live. And he's like, you know, one of your patients is here. She took an overdose. Hemodynamically, she's fine. You know, her blood pressure and all her medical checks are fine, but we're not sure what to do with her neuropsychiatric evaluation. And obviously, this is the middle of the night. I cannot be driving to Mutare. So we try as best as we could over the phone to try and do something. You know, so we come up with a plan, a strategy on how we're going to help Erica. Her name was Erica, 26 years old. And the plan was, you know, when Erica is discharged from the hospital, she should then be brought to Harare, where I live. She should come with her mother. 3 weeks down the line, I get a call from Erica's mother. And she says, well, a few days after Erica was discharged, she committed suicide. She hanged herself from the mango tree. That broke my heart. It stunned me. Over the years, after experiencing numerous painful stories like Erica's, I began to soul search to try and find a solution. And all along, as a psychiatrist, I had thought people should come to me if they need help. And I realized that wasn't going to work. I had to go to the people. And looking at the communities, I began to figure out what could really be done at community level. And we realized that the most stable, reliable resource at the community level are grandmothers. And we're kind of thinking, is it possible to train grandmothers in CBT, you know, cognitive behavioral therapy, something that takes a psychologist years, and doctors have to, you know, spend so many years trying to figure out that? And so in 2006, I started my first group of grandmothers who were trained in evidence-based talk therapy delivered on a park bench. There were 14. We now have more than 400 grandmothers who are trained in cognitive behavioral therapy, who are covering more than 70 communities. And in the last year alone, we've managed to assist more than 40,000 people, and most of those people presenting on the bench have suicidal ideation. And in our most recent publication in the Journal of the American Medical Association, we highlighted how after 6 months of receiving these services, people were still symptom-free and were not suicidal. Imagine if we could have a network of grandmothers. We call it the friendship bench in my country, a network of grandmothers in every major city that could reach out to people who were in need, to young people who were suicidal. I see no other appropriate way of remembering Erica and all the other people who have died or committed suicide, but to realize this dream would be an amazing way of remembering all these people. Thank you.